Even in today's world, it still may be a bit taboo to talk about having plastic surgery down there. But what some people don't realize is that there are a number of benefits that can happen to women if they have vaginal rejuvenation. So here to explain, we have certified plastic surgeon, Dr. Robert Heck with Columbus Aesthetic and Plastic Surgery. Dr. Heck, thanks for being with us.
Hi, thank you.
So the medical term for this is labiaplasty.
Yes.
Vaginal rejuvenation, how we refer to it. So explain to us what it is.
So vaginal rejuvenation is just a generic term. There are lots of different parts of female anatomy surrounding the vagina. The labia majora, the labia minora, and basically any surgery in that area to improve function or improve appearance is termed vaginal rejuvenation. The most popular of that is labiaplasty, and labiaplasty could be labia minora or labia majora. And by far the most popular procedure is labia minora surgery.
What would that fix, I guess, for a woman? What kind of issues may somebody have where they say, this is what I want to look into?
So the most common reason for labiaplasty is the appearance. As we get older, the labia become longer and discolored, and most women don't like the appearance. Some girls are just born that way. So majority of the women coming for labiaplasty is simply for appearance. But there are a lot of other issues with that. When you have elongated labia, you can have chafing, you can have pain with intercourse, you can have pain with bike riding or jogging. So it's very uncomfortable to have large labia.
And it could really impact daily life for a lot of these women, right? I mean, this is something that just saying all the issues that you can have, nobody wants to go through life like that.
Right. It does make a big difference in these women's lives. It just makes things more comfortable. Sometimes just wearing underwear can be uncomfortable, but things like jogging and running and biking can be very uncomfortable if your labia are too large.
Let's talk about the procedure then. Is it painful? Is it uncomfortable? How long does it take?
This procedure can be done in our office under a local. We typically put numbing cream to get the labia numb, and then we numb them with injections, and then basically trim them. The procedure takes about an hour. It's a relatively easy and bloodless procedure.
So recovery, how is that going to work?
So recovery is about a week before you're doing normal daily activities. It's about 6 weeks before you're resuming intercourse, horseback riding, bike riding, anything where you're putting pressure on that part of your body.
So as far as recovery, you wait that extended amount of time, but are you seeing permanent results? And then, is this something you have to get done again in the future?
No, the results are absolutely permanent. And, in our society today, a lot of women look at their anatomy and are embarrassed by it because it doesn't look like they perceive it to want to look, whether it's in magazines or on TV. If a woman looks different, especially in that part of her body, she can be embarrassed about it. And that's one of the biggest benefits of labiaplasty is that the appearance looks more like what we as society consider normal.
I would imagine too, women after having multiple babies run into this issue too, right? And all you want to do is kind of be back to the you were prior to having those children. So is that a good candidate for this as well?
Absolutely. Just like other parts of your body, your breast, your tummy, that skin gets stretched out and you lose your elasticity and things just don't come back. That part of your body also tells your age and starts to look older, and labiaplasty can fix that within an hour.
How important is it, and I'd imagine in this case even more so, that you find a doctor that you not only trust but that you're comfortable with?
So especially in this private area of your body, I think it's absolutely important that you find somebody that you're comfortable with, that you can relate to, that you have a good rapport with, and who does a lot of these, who has experience doing labiaplasty. We do tons of these every year, and I think it's very important.
All right, Dr. Heck, I want to thank you for being with us today.
Yeah, thank you.